And to be honest, I got burnt out probably within the first 2 years. Hey everyone, Dr. Siobhan France here, physical therapist, and welcome back to my channel. In today's video, I'm going to be sharing with you some of the top reasons why physical therapists are experiencing burnout. Now, these are some of the reasons why I personally experience burnout, but at this point, after being a physical therapist for 7.5 years, I have obviously had lots of conversations with physical therapists along the way. So I know for me, I got into this profession because I am super passionate about helping people. But if you don't know my story and you are new to my channel, my mom had a stroke when she was 29 years old. I was 5 years old. We had no idea something so tragic would happen to my mom. Both of my parents immigrated here from Trinidad to give my brother and I a better life, but who knew something like that would happen? Totally unpredicted. And I always grew up saying that I want to be like Tammy. Tammy was my mom's physical therapist. I knew growing up that I wanted to help people the way my mom was helped. And frankly, I feel like I got my mom back. And that's something I wanted to do for other people. So there I go, super passionate about physical therapy and diving headfirst into the profession, really excited about it. And to be honest, I got burnt out probably within the first 2 years. And I feel really sad about that because I absolutely love treating. So what happened to me within the first 2 years, I know is still happening to people right now. And one of those is double booking. But I'm primarily talking about an outpatient orthopedic clinic. Now, obviously, if you work in a different setting, like acute care or a skilled nursing facility, those settings are different. Even if you do home health, those settings are much different. I'm specifically talking about outpatient physical therapy because that's my personal experience. Although I do know that other physical therapists who are doing home health or in a nursing home or are in a different setting, they're also experiencing the same thing. But double booking, I know, is very unique to outpatient care. So being double booked is hard by itself, but when you're a heart-centered clinician, you are there for the patient. And it can be really difficult to have somebody else that you're double booked with, and probably in a 30-minute spot, this was my experience, in a 30-minute spot, and now you have attention over here and attention over there, and it can be hard to almost feel like you can give so much of yourself or give the best quality care because of the pressures of whatever the schedule is, if you're double booked. And if a patient comes late, then now you have to decide if you're gonna squeeze that patient in, and let's be real, we have to hit clinic numbers. There's a level of productivity that management wants for you to hit. Then you also run the risk of possibly management coming down on you, wondering why you didn't get that patient in. So that can be very challenging. And the more you continue to do that, be double booked and constantly feel like you can't give good quality care, then that leads to burnout. Now, one of the other things that leads to burnout is working with people who are negative. Now, I'm a super upbeat person. If you know me, then you know I am literally like the Energizer Bunny. I have energy for days. I can go and go and go. And I am always positive. I'm always looking for the upside and to be a positive light. So when you're in a clinic where people are negative, they're always being a Debbie Downer, they have something to complain about, it can be hard to be surrounded by those kinds of people when you're here to give good quality patient care and be there for the patient. It can be very challenging to be in an environment that is just so toxic. And then the sad part about that is you start to adapt who you are around. You kind of become like the average of the 5 people you hang around with most. So if you're spending so much time at work with negative people, without you even knowing it, you begin to mirror them. You begin to talk like them, act like them. There are things that you may not even be complaining about before, but now you're complaining about, just frankly because you're hearing it all the time. So if you don't create enough self-awareness within yourself, then now you are left complaining, which again leads to burnout. Okay, another thing that leads to burnout, let's talk about documentation. Woo! Now, documentation can be really challenging. So coupled with being double booked, you may not have time to document in between patients if someone is coming late or if you're double booked, then you might get backed up on doing notes. So either you're left with doing notes during your lunchtime or you're left with having all this paperwork at the end of your day when you are ready to go home because you've given your all to your patients, but you still have to write notes. Now I know that documentation is obviously a part of what we do, but it's the amount of patients with the time that we have and trying to document at the same time and make it super efficient where we feel like we're not cutting the patient off, but we still have enough time to actually document and give good quality care. Nobody likes to take work home. Everybody wants to leave the clinic and leave their work there. Nobody wants to have to take more paperwork home. And depending on the system that you use, then you may only have access to that system at work. So now you have to stay late or come early the next morning. There are some systems now that you can log in from home, like I know a WebPT, which is what I'm currently using right now at the clinic that I'm at. You can log in from home or from anywhere really, and you can do your notes. So yes, you can take it home, but who really wants to take it home? People really want to come home and enjoy their dinner, enjoy their significant other. Another thing that can lead to burnout is the kinds of patients that you are working with. There are some times where you get patients that really want to get better. And they're like, get me back on the court, get me back on the field, I need to play my tennis game, or I need to go back to golf, whatever it might be. They want to get back to sport. They want to return to their activity. And so they're willing to do the work. They're willing to do whatever it takes. But then you have another subset of patients who don't necessarily want to get better. Now, let me be very clear about this. There's a whole slew of things that causes pain. It is beyond just the physical body. So, you know, we're also treating patients that have mental health issues, that have emotional trauma, spiritual issues, things like that. And so that all plays a role in how they show up and how they feel physically. They may not be beyond some of their emotional stress and emotional trauma and spiritual trauma, and they may not be ready to actually physically commit to doing the work of getting better. But they're in your clinic because the doctor says, oh, you have knee pain, go to physical therapy and they will help you get better. So then people come into the clinic and they think that we are going to help them get better, and yes, we are, but we know that we can't do the work for them. They have to do the work. So it can be a little challenging when you really know somebody has the potential to get better, but they're just not putting in the work. That can really lead to burnout for a lot of clinicians who are just driving home let's get better, but then you have a patient who just has a lot of stuff going on, and that's really hard because we have a limited amount of time to really spend true one-on-one time with the patient. And although I would love to have deeper discussions about emotional trauma and emotional stress, one, that's out of my scope of practice and within the clinic. So I can't dive into all of that. And when the patient is there because the doctor says I need to be here, then they have less of a commitment. And it can be really challenging to work with people who are not as committed to their physical therapy and getting better. And I know we as clinicians, we are so gung-ho, we are so committed to our patients. We want them to get better. We know that they can, we know that we can help them, but when they don't match that kind of energy, that can be very draining. So if you are a clinician like myself that knows that it is possible for people to truly get better and you don't discount anyone because you know what the human body is capable of doing, it's hard to see somebody who doesn't have that motivation or that drive or that willingness to commit to their body. And we as clinicians either have to kind of go through the motions in hoping that they get there, or the end result is they really don't make a true change because they weren't really invested, they weren't really committed. And so that can be really draining on our energy. Now, I'm very energy based. Maybe you guys have noticed through watching all of my videos, I talk a lot about being in alignment and talking about protecting energy. So for somebody who wears their emotion and their heart on their sleeve, like myself, and who is an empath who just gets really affected when it comes to energy, then that mismatch of the energy between the clinician and the patient can truly lead to burnout. Now, again, this is just not one instance that happens and then you're one and done and you're totally burnt out. But I've been a therapist now for 7.5 years. And even some of the people I've talked to who've only been in practice for 1 to 2 years are already starting to experience this because the demand on physical therapists have really increased. So all of these compounded things over time leads to burnout. So I'm going to share with you the biggest reason why I, particularly for myself, am truly experiencing burnout, and maybe you can relate. I am a very creative person. I see everything as one big picture, but I also have a unique ability to see these multiple moving parts. And so my creative expression in the very beginning used to come out at work. I feel very expressive, I feel creative, I feel skilled, I know I'm good at what I do, and so I'm able to express that. So I'm being me fully, I'm showing up 100%, I'm truly standing in my purpose. However, over time, when I'm feeling stifled because I have a lot of patients right now, or I'm double booked, or I can't get my notes done, or management is telling me to bill more units, or whatever the case might be, all of that makes me feel stifled. All of that makes me feel like I am not in my creative ability. And when we are not truly expressing ourselves to our fullest potential, all of that leads to agitation. I truly have a desire, and I mean a desire, to help and shift people's lives in multiple facets, from body, mind, and spirit. And so for me, I feel like I was really doing that as a physical therapist. Even though I wasn't talking about emotional trauma and stress, I know that I was impacting their lives on an emotional level, on a spiritual level. I was getting them back to where they wanted to be, or almost achieving that. And so that got me excited. I felt expressive. I felt like myself. But the more I felt less creative, the more I felt less like myself at work, was the more I started to feel burned out. And much of that just came from the day-to-day operations that actually took me away from the actual treatment of the patient. I started having to focus on so many different things. And so what started to happen now was, in an outpatient environment, if we have a technician or a clinical assistant, however you call them, wherever you are, maybe you call them an aide, well, if they are not doing their job to their fullest potential, that brings more strain on the clinician. So now we are left to do other things that are not necessarily our job, but our true job is patient care. We are there to generate revenue for the clinic. So maybe doing a setup for ice and stim, or cleaning a table, although we can truly do those tasks, and I'm all for being a team player, when you have 5 notes that you still need to write and Sally is walking in, you feel stressed because now you have to clean your table, because you're going to clean your table a lot faster than waiting for the technician or the clinic assistant or the aide to come and do that for you. So you're hustling and bustling over here while you still have all this stuff over here. So over time, that didn't make me feel creative. It didn't make me feel expressive, and I'm just this person that needs to truly express who I am being so that I can have a massive impact on people. That is my ultimate mission, is to have a massive impact. And so my purpose has now shifted into helping you get out of healthcare burnout by starting an online business. So if that is actually what you would like to do, check the link in the description box, because I have actually put together a fail-proof guide on the things that you need to know in order to get started. So check down below. So all of those things over time really just made me feel burned out. And it was only so much that I could continue to sustain. I want to live up to my highest potential, to my highest purpose, and truly impact this world and help you do the same by living up to your highest potential and having you truly impact this world. So those are all of my tips. I tried to race through them and get through them as fast as I can. Maybe you can relate. Let me know if you are feeling burnt out. Comment below why you're feeling burnt out, and what particular aspect of burnout you are truly feeling. Maybe you're not even sure that you're experiencing burnout. Well, I made a video that you can check out right here on 3 signs to know that if you are experiencing burnout. But if you are thinking about starting a business, then make sure that you check the link down in the description box so we can help you get going. These are all the things that you need to know in the very beginning if you're in that thought process phase of wanting to start a business. Please share this video with anybody that you know can benefit from this, and be sure to like this video to let me know that you want more content like this and more solutions for your burnout. And if there is any particular video that you would like to see, then make sure you leave in the comments below so I can add that to my list of videos that I'm going to be creating for you guys. And if you have not subscribed yet, make sure that you do. Hit that subscribe button and hit the bell so you are notified when I post a new video. Thanks so much for watching, guys. I will see you all in the next one. Bye!